So we know that diabetes is a serious problem, and we know from facts that the South Asian community, so that is Pakistanis, Indians, Bangladeshis, are twice as likely to develop diabetes. We don't know why, but that's how it is. So they're quite stark figures. I think it's a wake-up call for us to really make changes in our lifestyle, and by that, as we have mentioned in our other videos, making sure that we do regular exercise, making sure that we eat all the right things, making sure that we get rid of the noise around us with, some of the common myths that we have about managing diabetes, and really live a healthy lifestyle. I think that's the key in terms of addressing the risk factors. So diabetes can lead to many complications. There's lots of medical terms for them. There's diabetic neuropathy, which means your feet are affected, sensation is affected, it affects your feet. You can get ulcers, you can get blue discoloration and all sorts. There's diabetic nephropathy, which means the bad effect of diabetes on kidneys. So the kidneys don't function as well. You start to lose protein from your kidneys. Then lots of other things. It affects your arteries. It can lead to heart attacks and strokes. It can affect the nerves. So there's a range of things that poor blood sugar control can do. Diabetic complications rather can be quite scary, and the single most important method or way to stop getting them or to reduce the risk of going to that stage is by controlling your blood sugars really well. And you could only do that with a healthy lifestyle, listening to your healthcare professionals, and really controlling your diabetes well. When it comes to the Pakistani community specifically, and I think that applies to the Bangladeshi or the Indian community too, is that fear of shame, that fear of being labelled as someone who has a disease. But like I said earlier on, it's a condition that is very, very common. It's very prevalent. Lots of people have it. So there is no reason why you should hide it. In fact, you should make people aware that you have the condition so they can be aware of complications and be there and ready to support you when, God forbid, if you have any of those complications. There is so much support out there. I think we need to come out of that bubble of feeling ashamed of having it and accepting that we have it. Only then we can access the right resources and manage it better. All patients who have diabetes are entitled to have an annual review, which means that per year, each year, they have the opportunity to go to their GP practice or their diabetes team and discuss with them the pros and cons of medications, their target levels of blood sugars, what their control is like, their lifestyle, have a checkup of all the main organs I talked about, the heart, the feet, the eyes, and put all of that together. So it's almost like a yearly checkup that we are all entitled to if you have diabetes. So the most important thing is for you to be aware when your annual reviews are, and for you to attend them without fail. Once you go there, be prepared, take lots of questions, use this opportunity to ask those questions, and any myths or anything that you've heard in the community, this is the time when you can take them to a healthcare professional and ask them for their professional advice. If English is not your first language, understandably it can be very, very difficult, just like for many other ethnicities or people from other different countries, and everything can seem a bit bizarre or everything can seem like a big block because obviously you can't converse in the language, and it can be hard. I understand that. However, there is lots of help available. So Diabetes UK is the first port of call. They have resources in our language, Urdu. Secondly, GP practices or even hospitals have access to translators. If you really struggle, my first advice would be to take somebody with you to your appointment that you trust, that you are friends with. It could be a family member, it could be a friend, it could be somebody from the community, somebody who you're happy to share your medical information with. Number one. Number two, if you don't have access to anything like that and you can't arrange something like that, speak to your team beforehand and arrange for a translator, and make sure there is somebody there who can help you understand the information that's been given to you, because if that understanding is not there, you will really struggle to deal with your diabetes. And last but not least, there's lots of online resources, Diabetes UK being one of them.